All right, so today we're going to do chapter 3 for MedAdmin and then chapters 1 through 9 for basic dosage calculations. So chapter 3 is in your Pearson book. I'm sorry, your pharmacology book. Chapters 1 through 9 is in your dosage calculation books. So by the end of class, you'll be able to differentiate the routes of administration and analyze the different routes and what's the benefits and risks of them. Utilize basic units of measurements and calculate correct doses. Okay. All right. So, what do you need to know before you give a drug? You have to know all this. All of this has to go into effect before you give that drug. Okay. What drug is ordered? The generic name, the class. What do you expect to happen? What do you expect the intended purpose and the expected effects? So what side effects am I looking for? What is the purpose of this medication? What are contraindications? What are all these things we've talked about? How it's supplied, how it's administered. Okay. Big deal. If you mess up on one of these, you can hurt someone, right? If it's supplied from pharmacy in a liquid, but it's ordered as a tablet, you can't give it, right? How it's administered. Okay, if it's a powder, let's say it's a let's say we have a powdered drug. It's in a little canister. If you don't read the instructions, number one, you don't know where to put the powder. Number two, what if you're supposed to take the powder and mix it with water, and then it becomes a liquid and you're supposed to drink it? Or what if you're supposed to put the powder in my skin? What if I'm supposed to inhale the powder? What if I'm supposed to do whatever? So reading the instructions is super important. Okay. That is what an order is, instructions. All right. So we have to attain the important information before we give a medication. Doing an assessment. If you don't know what your patient looks like before you give them drugs, I don't care if it's literally an aspirin, okay? If I didn't do an assessment on you, I'm not giving you aspirin. I'm doing a quick head to toe because I want to make sure we don't have any complications. Because if I give you this aspirin and I didn't notice that you had some, increased bleeding and your gums are bleeding, you're having increased bleeding and bruising in your stomach, you're bleeding out internally, and then I give you another aspirin, even though aspirin's safe, right? Everyone takes it all the time. And now I've just overdosed you on aspirin and you've bled out internally and you died. But I didn't know that because I didn't do an assessment first. Okay, that's the whole point. Vital signs and assessment have to be done before. Period. Another thing that is included in pertinent information, allergies. If I don't check your allergies, I don't ask you what your allergies are before I give you a medication, and then I give you the medication you're allergic to, and then you have anaphylaxis and you die, it's a big deal. All right. So adverse events. So we have adverse events and adverse effects. So when we talk about adverse events, these are not what we want to happen. These are our death, our anaphylaxis, okay? We don't like that, the event of an adverse reaction. Sometimes your adverse effects, which we're going to talk about on the next slide, can become adverse events, but these are preventable usually, okay? If you check your patient's allergies, if you checked your patient's blood pressure before you gave them their blood pressure medicine, these can be preventable. Okay, so this is like when my patient's blood pressure is 80/50, and then I give them 3 blood pressure medicines on top of it, and now their blood pressure is 0. That's an adverse event. That was preventable. If I would have done my assessment first. Okay. All right. Our side effects or our adverse effects. Okay. Side effects are non-therapeutic reactions to the drugs. So these are things that we know are going to happen, right? These are known, like we know you're going to have nausea and vomiting. We know we're going to have hypotension with this medication, right? But if I do my proper data before and either hold or give the drug, depending on that, we can maybe prevent the side effects from happening, okay? Our allergic reactions are anaphylactic reactions, okay? You have to check those before administration, right? We have to see what are you allergic to? What herbal supplements are you allergic to? I know this sounds stupid, but even what food are you allergic to? Because sometimes they get these medications from food. Okay. They get gel capsules from pork. If you're allergic to pork, I can't give you a gel capsule. I can't give you heparin because it's made from pork. Okay. Um, but if I don't check your allergies beforehand, I don't know. Okay. And we're talking about an allergy, we're not talking about a side effect. Nausea and vomiting is not really an allergic reaction. Okay. You know, they measure allergic reactions mild to severe. Your mild might be like a small rash. Your severe, is throat closing, anaphylaxis, anaphylactic shock. Okay. Your patient, I'm gonna tell you, they're gonna get these two confused because I've had so many people tell me they're allergic to this, and I'm like, you literally can't be allergic to it. Someone told me they were allergic to epinephrine, and I said, you're allergic to epinephrine, which is a natural substance in your body. Okay. And she said, yeah. I said, okay. That is not the end of the conversation, right? When they say, hey, I'm allergic to this, you have to say, what happens, right? So I said, what happens when you take epinephrine? She said, oh, well, my heart races. I said, okay, well, that's an intended side effect. We want that to happen when we give you epinephrine. So that's not an allergy. That's a side effect. That's a known side effect. That's an okay side effect. We're okay with it. So they will trick you there, but you have to know what the difference is. Okay. Paradoxical effects are when they have the opposite effect. How many times when you gave your child Benadryl? Benadryl makes you drowsy. It's a CNS depressant. Okay. And your little kid bounces off the wall for 5 minutes, for 5 hours. Okay. That's the paradoxical effect. We wanted them to get drowsy and for it to not release those histamines. And then it had the paradoxical effect of bouncing off the wall for 5 minutes, 5 hours. I keep saying minutes. Sorry. All right. So the six rights: right patient, medication, dose, route, time, and documentation. Period. That's them. Know them. Know the 7 parts of the order. Know your triple check. So let's go over. When you ask the patient, how do you know you have the right patient? Number one, you ask. But what do you ask? Do you say, hey, are you Mr. Smith? Hey, I've got some morphine for Mr. Smith. Are you Mr. Smith? Do you know what your patient's going to say? Yup, I sure am, Mr. Smith. Please give me that morphine. And that's not true. You can't do that, right? You have to say, tell me your name and date of birth. And then if they can't, we look at their armband. We check their armband to the MAR. We check what they're saying to the MAR. I check what they're saying to their armband to the MAR. I check all three. Okay. Right medication, right dose, right route, right time. That's pretty self-explanatory. If I don't have the right medication, I'm going to give them the wrong one, right? If I don't have the right dose, I'm going to overdose or underdose somebody. If I don't have the right route, I could kill someone. Because I've seen it happen where people try to give a liquid, they pull up a liquid medication in a syringe, and then they are so used to pushing syringes that they hook it up to an IV and they push the liquid medication through your IV, and then they kill them because it's not the right route and they can't be transferred. Okay. Right time. That means that if it's ordered every 4 hours, I'm giving it every 4 hours. If it's ordered by twice daily, I'm giving it twice daily. Okay. And if it's too early, it's too early. If it's too late, if it's too close to the next dose, we might need to edit it. Okay. The right documentation, because if you don't document it, it didn't happen. That means pre and post. If I'm giving someone blood pressure medicine or a PRN medication, which means as needed, sorry. If I'm giving them a medication that's PRN, which means as needed. If it says every 4 hours and then it's got some parameters, PRN for pain 4 out of 10, 4 to 7, right? It's got a range. If I don't document a pain assessment, 4 out of 7, how do I know that this was the right drug, right? So it's pre and post documentation. So when I say pre-documentation, it means that if it's got parameters, if it's got specific things that it's supposed to do, and you're not supposed to give it if it's this, or you're supposed to give it if it's that, I've got to have that charted already or at the same time. Because if it's not in there, then why did I give it? Right? If it says it had a 0 to 10 pain and then I just gave them morphine, for no reason. That's what it looks like for no reason, right? So that pre-documentation is important. The the actual documentation of the medication is important because if I don't document morphine, I gave them morphine at 6:45 p.m. They said their pain's a 10 out of 10. I gave it to them. I didn't chart anything. The night nurse came at 7:30. The patient still says their pain's a 10 out of 10. And she says, oh, well, the morphine's due. No one's given it. And she double doses, gives him morphine. The patient's dead. You've overdosed them with morphine. They're dead. Okay. And you have to have the post documentation. So if I give someone blood pressure medicine, I expect it to go down, their blood pressure to go down. How do you know that happens? If you don't document it. Okay. If I give someone morphine, I expect their pain level to go down. So I have to document after as well. Okay. I went from a 10 out of 10 to a 9 out of 10. I went from a 10 out of 10 to a 4 out of 10, right? We have that post documentation to make sure it worked. Okay. Also, I'm checking on my patient to make sure that they're alive after I gave them a bunch of morphine. All right, your 7 parts of the order. Number 1, patient, medication, dose, route, frequency. If I'm missing one of those, if I'm missing any of the 7 parts, I can't do it. Okay. If I don't know who to give it to, if I don't know what to give them, if I don't know how much to give them, if I don't know where to give them, how to give it to them, when to give it to them, I can't do it, right? The extra part is the signature and the date and time it's written. Prescriptions only last, paper prescriptions only last a year. And then if it's a narcotic, it's even shorter than that. Okay. If my ER doctor wrote it and now they're on the floor, that ER doctor's orders don't matter anymore because the ER doctor released their care. We need to know who wrote it. Okay. That's why we have to have the name and the signature. And then our triple check. So that's our pull pass prep. So when we pull the medication out of our Pyxis, okay, so that means we have a Pyxis machine, which is like a automated dispenser of medications. When I pull it out of there, I'm checking what's in my hand to the MAR. Okay, this said it's supposed to be lisinopril 10. This is lisinopril 10. My order is for lisinopril 10. Perfect. I'm going now I have to prepare my lisinopril, right? I have to draw, let's say I'm drawing up my medication. When I draw it up or if I'm looking at it and I'm preparing it, I'm making sure that this 10 milligram tablet is the one I'm supposed to give. Because what if it's supposed to be what if I have a 10 milligram tablet and they're supposed to get 5? I might need a half it, right? And then before I give it, I check it again, right? I'm checking the patient and I'm checking my MAR. And when I'm saying what we're checking for, where am I? We're checking the 6 rights, okay? Do I have the right patient, the right medication, dose, time, route? All these 6 rights, that's what we're doing in the triple check. So each time I'm doing those checks, I'm checking for this. Okay. All right. The other important thing when I'm preparing my medications, it better be quiet. Okay. If it's not quiet, I can't prepare medications. That's why a lot of times in your med rooms, it says a quiet zone because they have done studies and they've done a lot of statistical data that has said that the more busy, the louder your your med room is, the more mistakes are made. Okay. We don't want to make mistakes. I want to give my patient exactly what they need when they need. Okay. So if your patient, if somebody comes in chit-chatting away to you and you're trying to pull up or prepare your medications, you need to ask them to be quiet nicely, or ask them, can we do this at a later time? Not right now, right? Don't stop what you're doing because you have meds and they have orders and they need to get these meds, right? We don't stop, but we need to say, hey, let's go. Let's finish this up later. Not right now. I need to focus. Okay. All right. So why do medicines work? Why do they not work? Okay. We like them to work. That means that you have to take them at the right time when you're supposed to, every day, things like that, every other day, whatever that means. Okay. When you formulate a care plan for your patient, you want them to be able to participate in their care. Can they help themselves? Can they give themselves their own meds? Things like that. Factors that can influence adherence: expensive, if the drug is really expensive, if there's a bunch of side effects, or they self-dose. Okay, that's a big one. So expensive is a big one too, because not everyone has money, right? We know that there's people who don't have any money and they can't afford their medication. If they have a bunch of side effects, we might need to find out if they have these side effects, or we need to change the medications to decrease the side effects, or give them this other medication that stops this side effect from happening, right? And then how many times do you have your patient who says, you know what, I'll just take 2 of these. I missed yesterday's dose, so I'll take 2 of this dose. Well, now I've killed myself. Okay. Either out of fear, or they want an increased desired effect, right? They want that high feeling, or they want something good. But we also have to think about knowledge. It's not even on here. Okay. Knowledge. Can I participate in my care? Do I have the IQ, or the um just the knowledge to do that, right? What if my patient can't read? They can't read the drug label. They don't know what medicine each one is, right? We might have to come up with some kind of system that says, okay, well, the triangle is your blood pressure medicine and the circle is your diabetes medicine. Don't get them confused. Okay. And then you help them figure it out. What if if it's a cultural thing? Okay. What if they don't use clocks? I know a lot of Native American cultures don't use standard clocks. Okay. Or if they don't know how to read a clock. Okay. And they need to take this medication 3 or 4 times a day. Right? You can get them that lovely little pill organizer. That's great, right? It organizes it at least, but it still doesn't help me take it the right time. So I can either take it, you have to find out what their schedule is and talk to them. You get them according to their schedule, okay? So if you need to take it 4 times a day, I'm gonna take it right when I wake up, my first meal. I'm gonna take it with each of my meals, and then once at bedtime, right? Or if I only need to take it 3 times a day, I'm gonna take it with each of 3 of my meals. If they don't eat 3 meals, I'm gonna take it as soon as I wake up, about midday, whenever I see the sun's in the middle, right? And then right before I go to bed. Anytime during the midday is good. Morning and night. What if they work night? There's things you have to think about, okay? All right. So different types of orders. So there's stat, which means immediately, right now. ASAP means within 30 minutes. Never seen an ASAP. I've only seen a stat. These are also one-time only orders. There is no point of being a stat order if it's going to be stat every 4 hours or stat every other day, because that doesn't mean anything. And it's just every 4 hours or every other day. Okay. Single dose orders or once dose orders means I give it one time and I can only give it that one time. So that means when I have my morphine, that's every 4 hours, and my patient's screaming and crying and they say, I'm in pain, I'm in pain, I'm in pain. The morphine's not helping. And I call and I get that 1 dose of Dilaudid. It's a one-time dose, so I can give it to them one time. And then after that, it's over. They don't get it ever again, or unless they reorder it. Your PRN, that's pro rata, it's Latin, I'm guessing. Okay, it is dictated by the patient's condition. So like that's what I'm saying, they usually have parameters. So PRN for nausea, PRN for blood pressure, this, PRN for that, PRN for this. The parameters tell you when you can give it. Okay. Our routine, our standing orders. Routine orders are all your other orders. Usually it needs to be given within 2 hours, so an hour before, an hour after. So if they have once daily medications, right? Our standing orders are medications that are, sometimes we have standing orders for emergency situations. So if my patient's having a heart attack, I have this list of drugs that I know the cardiologist has written for if they're having a STEMI, right, or heart attack. He wants these 5 medications to be given. And so I give them because it's a standing order. Okay. I don't need to call the doctor and say, hey, they're having a heart attack. What do you want? Do you want me to give these 5 medicines? Or, hey, they're having a heart attack. What do you want me to give them? Because he's already written it and it's a protocol or a standing order. Okay. All right. So how do we measure doses? We use the metric system, not the imperial system, which is what American uses. So we use liters, milliliters, kilograms, grams, micrograms, milligrams. We don't use apothecary systems or household measurements like cups. We still use tablespoons. We don't use like cups. Okay. All right. So there's 3 different types of 3 different categories of drug administrations. There's enteral, There's topical and parenteral. So enteral is our PO, or things that have to be absorbed through the GI tract. Okay, so our oral is considered the most common and it's considered the most safe because it takes a long time to work. Okay, we know that liquids are faster than our regular pills, and then we know enteric coated or even slower than that because the um the stomach has to dissolve the enteric coating to get to the medication, so it takes even longer. Okay, there's lots of different forms of tablets and capsules. Based on your patient, we decide what kind to get. Okay, if it comes in a liquid, you have to call the doctor to get an alteration for a altered formulation, but we can crush pills and we'll talk about that on the next slide, okay? Just don't let me forget. All right. Yeah, we talked about bioavailability. Sometimes if we know the liquids have a higher bioavailability than our enteric coated. Okay. So these are different types of pills. Our capsules are enteric coated. See how they look like an M&M. Okay. Caplets are our tablets, our gel caps. So capsules, we cannot crush a capsule, right? There are specific capsules that you can open. And how do you know that? You have to read it. You have to look it up. If the capsule says it can be opened, you can open it and then that's fine. But if it doesn't say that, you can't do it. We can never we can never half crush, do anything to these enteric coated tablets. Enteric coated tablets, delayed release tablets, sustained release tablets, extended release, that's ER, DR, SR, you can't crush them because they have a coating on it. And if I crush it, I've defeated the purpose. I've gotten rid of the coating, and then it's going to dissolve in my stomach way too fast, and then I'm going to overdose, or I'm not going to get the adequate relief, or it's not going to work, period. Okay, we do not crush enteric EC, so enteric coated, delayed release, sustained released, or extended release. Our capsules, we can crush any of these other ones. Okay, if it says that I can open these, great. If it doesn't, you can't. You gotta find something else. This score means that it has that half mark. That means that you can half it. If it does not have a score, if your tablets are not scored, you cannot half it. Okay, which means it's all or nothing. And if you can't give it, you got to get the right dose. Okay, your caplets, that's like your vitamins. They're they disintegrate a lot. And then our gel caps, we cannot crush gel caps either. You can dissolve them in like hot water for like 5 minutes, but I promise you, what's inside this gel cap? Liquid. You can just get me the liquid form. All of these come in a liquid form. Okay, sorry. Went the wrong way. So if your patient has difficulty swallowing, number one, before we even get there, we have to assess someone swallowing. If it's the first time I'm seeing this patient, if they're just waking up from surgery, if they just had some kind of event, we have to assess their swallowing. If they cannot swallow, we cannot give them these pills. We have to find some other way. Okay? If they have difficulty swallowing or trouble swallowing, we can crush tablets. We can crush in any of the ones we've talked about, right? And then put it in applesauce, pudding, whatever, ice cream, whatever they want. Okay. But the key is difficulty versus inability. Difficulty, they may need to have that speech therapist come and tell me what phase they need because there's different thicknesses they may need. But that inability means I can't swallow at all. You better not put anything in their mouth. Okay. I don't care if it's liquid. I don't care what it is. Don't put anything in their mouth. Inability means inability, and that means I'm going to choke and die. Okay. All right. So we have this is also enteral, transmucosal drugs. We have our sublingual. Sub is under lingual tongue, under your tongue. Buccal means it's in your cheek, right here. Okay. These, your mouth has a mucous membrane, so it's pretty fast absorption. So it goes right into your bloodstream really, really fast. These are great for when we have problems with digestion or swallowing. I still don't even give these to people who have trouble swallowing, but you can because it dissolves so fast. But sometimes they forget and then they swallow and then anyway. But the important part is that you do not drink anything after because you need to wait until they dissolve that 30 seconds to a minute. If it's not fully dissolved and then you drink something, you're just going to take it and it's going to be absorbed in your stomach and it's going to defeat the purpose. I want it to be absorbed very fast. Okay. ODTs, same thing, just means it can dissolve anywhere in your mouth. Anyway, same thing. All right. NG and G tubes. Doesn't matter what they are because they're just tubes that sit in your stomach, whether it starts in your nose and ends in your stomach, whether it starts outside your body and ends in your stomach. The whole purpose is it is a tube that sits in your stomach. Okay. So these are when our patients cannot swallow at all. We bypass this whole swallow reflex. Okay. And put it directly into their stomach. To do so, we have to crush the pills or they have to become a liquid. It either has to be a liquid form, a powder form that we can make into a liquid, or we have to crush them. So same rules apply. If it's enteric coated, sustained release, delayed release, extended release, we cannot crush them. If it's a capsule that says do not open, we can't use it. We have to find something else. Okay. We love a liquid that goes through it because that means it's not going to get clogged because it is still a tube. All right. So now we have topical. Topical is our dermatological preparations. So this is our lotions, creams, gels, powder. What do you need when you go to apply these? You better wear gloves because whatever you touch, if you don't wear gloves, you're getting absorbed too. Okay, our installations and our irrigations, which means drop by drop. Okay, those are to our body cavities, our eye drops, our nose sprays, we can have rectal, vaginal, and bladder irrigations. Okay. Once again, wear gloves, especially if it's rectal or vaginal. Okay. And we have inhalations. These are our inhalers, nebulizers, our breathing treatments. Okay. Yeah, I mean, you should wear gloves too, but it's not as important because we're not touching the medication. Okay. This just means that they inhale it. Okay. For these powders, we have to make sure for all of these, we're about to talk about it. Okay. So the important thing about these topicals is that they only are absorbed topically. That means that they are very rarely absorbed systemically. It is a local reaction. If I only have a rash right here, I only want it to work right here. Okay. I don't want it to absorb through my skin and get into my bloodstream and then I have systemic effects. Okay. Sometimes it happens, but it's very rare. Okay. Most important thing is that I don't put it on skin that is broken. Now you're going to say, but wait, what if it needs to go on like a wound? Okay. Unless otherwise directed, do not put it on an open wound. Okay. So yeah, Neosporin, that's supposed to go on an open wound, right? But if I'm giving you a Voltaren gel, which is like an anti-inflammatory gel, I don't want that to go into an open wound. Okay, use common sense. If it's supposed to go on an open wound, put it on an open wound. If it isn't, don't. We have to also make sure we're checking our skin for breakdown. Because if I put this very strong steroid cream on my skin every day, it may become red and inflamed. Okay, so we still have to monitor our skin. So what was also included in this is our transdermal. So these are our patches. Our patches, once again, we need to have a clean, dry surface, just like with our creams and lotions, okay? If it's wet, the lotion's going to turn to water. If it's wet, the powder turns into a paste. It doesn't work. Same thing with this. If it's wet, it's not going to stick to my arm. Okay. It's pretty slow delivery. The rate is variable because it depends on the type of medication and where you put it. It cannot go on a hairy site because if it's sticking to hair, it's not sticking to my skin. It cannot go on an open wound. You do not cover patches ever. You can cover cream. We love to cover cream. Covering cream is great, especially if it's like a Vaseline cream. It's like a thicker, oily one, right? We don't want it to get on our clothes. That's fine. A patch, never cover. Okay. Either one, if we cover our cream or we put on a patch, after we put it on the skin, we clean the skin, we dry it, we put the patch on, we need to initial time and date it because we need to know when to take it off. Okay. Same thing with the bandage for the cream. If you don't know when time it was put on, you don't know what time to take it off. Never cut a transdermal patch either. Once again, wear gloves. If you cut it, you've just rendered it ineffective. It just isn't going to work. Okay. We need to rotate sites as well. So if we could put it here, the next day we need to put it here. Now there are certain medications that go in the same spot. Like think about your icy hot patch. Icy hot patch goes in my lower back because that's where I hurt, is my lower back. Okay. But the key there is that we have breaks. We have 12-hour breaks. Because if we put a patch in the same spot over and over and over again, especially if you're me and I'm allergic to adhesive, my skin's going to get irritated and it's going to hurt and get breakdown. All right, so then we have ophthalmic, otic, and nasal. Ophthalmic is your eye. So this is eye infections. This is how we give it to people in an eye. The most important thing about an eye drop. You'll learn in nursing 113 how to actually do it. But the two most important things is one, you hold that lacrimal duct after, which means you hold your tear duct after administration of the eye drops, because if you're not holding that lacrimal duct, it's going to become systemic. Okay. The way you make tears is it pulls water from your body. How does it get the water from your body? It's part of your bloodstream. So if you don't hold that there, the medication that we wanted to work in our eyes is now working in the rest of our body. We don't like that. I want it to work here. The second most important thing is that you never touch the dropper to your eye. If you touch the bottle to your eye, and you have an eye infection, you've just infected that whole bottle with God knows what. Okay, don't do it. Don't touch it to your eye. Don't forget to hold the lacrimal duct. For ears, the most important thing is just how to hold the ear. For adults, it's A, C. Adults is up and back, kids are down and back. Okay, that's mainly what it is. If the ear is, this is to treat outer infections because obviously we can't get inside the ear because of the tympanic membrane. Okay. But if we don't hold the ear right, we don't flatten those ear canals, and so it doesn't get all the way down to the tympanic membrane. Nasal administration, this means a nasal spray. This is also a mucous membrane, so it can have systemic effects, but they're generally pretty safe. The only important thing there is that we blow our nose before and we don't blow our nose after. Okay, if I don't blow my nose before and then I spray something in a stuffy nose, it's not going anywhere. If I blow my nose after I've just sprayed my nasal cavity with spray, I've just shot the medication right back out, and then it's not going anywhere. All right, vaginal. I mean, it's pretty self-explanatory. It goes in the vagina. Okay. This can be a suppository, a jelly, a cream, a foam. A lot of times the creams look like a tampon. It comes in like an applicator. Make sure you use lube for any of these. Okay, if it's going intravaginal, clean the area. Make sure you lube it up. And then you insert it, you press the bottom, it'll squirt out the cream. The cream stays in there. Make sure you have a pad underneath it because gravity happens, right? They need to stay in that position for a while because if they stand up, it's gonna come out. All right, rectal, same thing almost. Number one, for both of these, clean the area and make sure you're wearing gloves. Lube, you put it in there, it's past that first sphincter. This is a great administration for when you're vomiting or when you have someone who can't swallow. This is what we're talking about, getting another route. Okay. Absorption is slow. The first pass effect is usually avoided. That's all great things. All right. So then we have parenteral. So these are our injections. We have intradermal, which means it's right under the dermis. Subcutaneous, it's in that fat layer, and then IM is in the muscle. So our sub-Q, we're really not going to talk about intradermal. Sub-Q is in the fat, deep tissue. Always say do the Macarena. Okay, so it's the backs of the arms, right under the scapula, right in that like right under your bra fat. Okay, your abdomen, and then the tops of your thighs. We want that good, thick, fatty tissue. You have to pinch. If you aren't pinching, you aren't ensuring it's in the space. All right, and then IM, our three famous IM spots are deltoid, ventrogluteal, and vastus lateralis. There are pictures in your nursing book to go look at, or you can Google them. We know that ventrogluteal, which is the side of our hips, that is our most preferred site. It's one of the bigger muscles. It's safer and it's less likely to go in the wrong space. We love the ventrogluteal site. Okay, it is not deltoid. Deltoid is not preferred. All right. Yeah. All right. So this is how to read a drug label. So we have our trade name and our generic. For Charity School of Nursing, we will only use generic. Ever. Ever. Don't ask me what we're going to use because I'm going to say later, I'm going to say, I don't know. Okay. I'm telling you right now, generics only. Okay. Sorry. Generics only. The way you know it's a generic is it's usually lowercase, right? This is uppercase. This tells you how many capsules are in here, how many milligrams per capsule. Look at these yourself and try to read them yourself, okay? The important thing about this is that it says when mixed. So we have over here a reconstitution. This tells you 55 milliliters need to be added to this powder of water, and then you shake it, and then it becomes the 250 per 5, okay? That means if I use 54, I'm not going to get this concentration. If I use 56, I'm not getting this concentration. If I use distilled water or sterile water over water, I may mess up the chemical composition. I have to follow these instructions to a T. These are important, okay? When we're doing the math that goes along with this number is trash. I don't care how many milliliters that you put in there, right? When we're doing math, because our concentration is what we want, and I'll show you a little later, okay? Once again, read them yourself. This is a very long lecture, so, okay. Controlled 2, that's what that means. Oxycontin or oxycodone extended release. See, it said the ER, so you can't crush it, okay? That means controlled substance 2. That means it's a level or a Schedule 2 drug, okay? They all have that on there if they're a controlled substance. We use military time. If you don't know military time, you better learn it. Okay. And then these are all of our abbreviations. I'm not going to read these to you. You can read. You are still responsible for them. Okay? All right. What we do not use, though, our do not use list. So this is according to JCO, which is a Joint Commission Accreditation Board. They said we do not use U's. We never write U because U looks like unit. It doesn't look like unit. It looks like IU. It looks like O. It looks like 4. So we write out unit. We don't use IU because that looks like IV or 10. You don't use QD. QD, which means daily. We still use it all the time. But for this purpose, we don't use it. We also don't use QOD because sometimes the O is mistaken for an I, and QID means 4 times a day. Whereas this means every other day. That's a big difference. Okay. Yeah. Okay, our trailing versus our leading zeros. If we use a trailing zero, so if our answer is 4, we don't put 4.0 because 4.0 looks like 40. We put 4. If our answer is 0.4, we don't put 0.4 because the 0.4 could look like 4. We write 0.4. We're going to talk about that in a second. You don't use MS or MSO4, MgSO4 because they get mistaken for each other. And magnesium and morphine are big. They're very different. Okay. The other thing we don't use greater than or less than equals because I ain't seen nobody ever get those right. Never. We don't abbreviate the names of drugs because you will misinterpret them. We don't use the at symbol. We don't use cc. We only use milliliters. 1 milliliter is 1 cc. They mean the same thing. And we don't use this little, I don't know what that is. I don't know what you would call that character. We don't use that character because it looks like milligrams, but that means micrograms. I think it's like Swedish or something. I don't know. We don't use it. Cool. We write out micrograms or mcg. All right, rounding. Now you're all gonna laugh at me and you're gonna be like, yeah, I know how to round, but I'm gonna tell you right now the amount of problems I have with rounding. You wouldn't believe. Okay. So a quick refresh. Thousandths, hundredths, tenths, ones. Okay. If it says round to the whole number, that means this is one of these. Okay. The whole number. If it says round to the tenths, the thousandths, or the tenths, hundredths, thousandths, that's what this means. Okay. So tenths, hundredths, thousandths. So let's look at it. If I have this as my answer, but the answer says, oh, that's okay. But the answer says round to the nearest tenth. How do we round this? We know this is the tenth space, and to round to the tenths, we have to look at the space behind it. So it's a 2, and the one behind it is a 6. If the one behind the spot that you want is 5 and over, you round up. If it's 4 and down, you let it stand. You don't touch it. I'll show you on the next slide. So when I round to the tenths, this is the spot I want, but the 6 is over 5, so I round up. So the answer is 1.3. Okay. All right, so this is what we're talking about. If this is my number, 3.726, and I want to round to the hundredths. Okay, so we know this is tenths, hundredths, thousandths. It's already rounded to the thousandths. So if I want to round to the hundredths, I want to round to this 2. Okay, so the answer is not 3.72. It's 3.73 because the 6 makes it go up. Okay, if I want to round to the tenths, the answer is 3.7 because this 2 is less than 5. That means it doesn't round up. We let it stand. We let it be. It is what it is, 3.7. If I want to round to the whole number, that means I take this 3 only and look at the 7 behind it. The 7 is over 5, so it rounds up. The answer is 4. All right. When do you round? When you are asked. If it doesn't have instructions to round, you leave it as is. If it does not tell you to round, you leave it as is. If it says round to the tenths, round to the tenths, round to the hundredths, whatever it says do it. Otherwise, don't round, ever. If it says nothing, don't round. All right. So, we actually don't worry about, sorry, any of these. I care about the teaspoons, the pounds, and that's about it. Okay? Oh, wait. Yeah, it's cool. We don't use CC anymore, so we don't have to worry about this one. We need to know all these. And once again, I don't care about this cup, pint, quart, crap. Okay, don't care about anything else. I want all those though, okay? And this link, we don't use link. So all of these acronyms, all of these conversions, you are responsible for knowing them all up here. You will not be given a list of these. You have to know them. All right, so let's talk about some math. All right, so you know there's 1,000 ways to do everything. Okay, sorry. I don't want a laser pointer. So there's always two ways to do things. I like dimensional analysis. A lot of people like desired over have. That's fine. I'm going to teach you both. Hate it for you if you don't like the other way. You're going to have to sit through it. Someone uses it, someone needs it. So we're going to have to talk about both of them. Okay? All right. So a patient needs to drink 1.5 ounces of this elixir a day. How many teaspoons is that equivalent to? Okay? So dimensional analysis, I always do my way first because that's the only way I know how to do any of this. I have to teach myself the other. Okay. I know these are my conversions up here. 1 ounce is 2 tablespoons. 3 teaspoons is 1 tablespoons. There is a lot of different conversions. You could do ounces to milliliters and then milliliters to teaspoons. That's fine too. This is just the easier way for me to do it. Okay. So when I do dimensional analysis, that's this right here. Okay. Ooh, sorry. That's this right here. Okay. So I always start with what I want first. I'm looking for teaspoons because that's what the question is asking for. So I put my 3 teaspoons and my 1 tablespoon. That's where I got it from, right there. Okay. Right. And then I say, okay, do I have, I put on top what I want, my teaspoons, my little t. Do I have any tablespoons? Yeah, I have another conversion. I have 2 tablespoons, 1 ounce. How do I know what goes on top? I know what goes on top because of what I put on bottom, and they've got to be able to cross out. Okay. So then I have my next conversion, and then I can throw in my ounces that I have is 1.5 ounces. Okay. So that's why I cross these out. My tablespoons cross out. My ounces cross out. I'm left with teaspoons. There is no other unit of measurement here. I know I have the right answer. I used all the numbers that I needed to use, and I used my conversions correctly, and I have teaspoons. That's what my question is asking for, and it is on top. So I multiply across 3 times 2 times 1.5. It equals 9. 1 times 1 is 1 is 1. 1 and 9 is 9. The answer is 9. So if I'm doing dimensional analysis, that is how you do that. I like dimensional analysis because I never have to worry about if I know what to divide or what to multiply. It's done for me. I'm done. I just write it all out. That's why I like it. The desired over have. So you have to have these 2 conversions. This is 2 things that you have to remember. If it is smaller to larger, you divide. If it's larger to smaller, you multiply. Students love drugs, love sex, money. Just ways to remember things, okay? But so which one's bigger, teaspoons or ounces? We're going smaller. I'm sorry. Which one's bigger? The biggest one is this ounces. So we're going from large ounces to smaller teaspoons. So we need to multiply our conversions. So we take our 1.5 ounces, that's our desired. You multiply by our conversion, 2 tablespoons, we get 3 tablespoons. I have to convert it again. So 3 times 3, because 3 teaspoons is 1 tablespoon, right? So 3 tablespoons times 3 teaspoons is 9 teaspoons. You get the same answer. It's not the greatest one to show you dimensional analysis, desired over have. It'll get different as we go. All right, so now we have a patient weighs 5 pounds, 8 ounces. How many ounces total does the patient weigh? So, come on. Why are you being like this to me? Okay, so once again, I'm looking for ounces, so I put my ounces over here. My conversion is 1 pound is 16 ounces. I'm looking for ounces. I don't have any ounces, so I have to throw my conversion in. 16 ounces is 1 pound. Do I have any other pounds up here? Yes. I have 5.5 pounds. I throw in my 5 pounds. So now my pounds cross out. And we all remember back in math how any whole number is understood, have a 1 underneath it. That's where I got the 1. Okay. So I've crossed out my pounds. I've used almost all the numbers that I'm supposed to use, and I'm left with the unit of measurement I want. 16 times 5 is 80. 1 times 1 is 1. 1 divided by 80 is 80. So 80 ounces. But we still have this 8 ounces to add in. So you add 8, it's 88. Okay, so the correct answer is 88. I definitely suggest pausing these and try to work them yourself before I go over them. So if I'm doing desired over have, I'm going from larger to smaller, okay, because it takes 16 to equal 1. So I need to multiply. 5 times 16 is 80, plus 8 is 88. All right. All right, so now we have a patient who needs digoxin. Yeah, digoxin 125 micrograms. How many milligrams of this would you give? So I start with what my question is asking for, milligrams. Milligrams. I don't have any milligrams up here, but I do have a conversion. 1 milligram is 1,000 micrograms. So I put that 1 milligram, 1,000 micrograms. Do I have any micrograms? Because whatever I do at the bottom, I've got it at the top so that they can cross out. I have my 125. So I multiply across. 125 times 1, 1,000 times 1 is 100. You divide and you get 0.125. Okay, once again, this time I'm going from small to larger because it takes 1,000 micrograms to equal 1 milligram. So I take my desired goes on top, and what I have is my conversion goes on bottom, and you divide, and you get 0.125. Okay. All right. So now I need some teaspoons into milliliters. Number 1, my conversion. 1 teaspoon is 5 milliliters. So I start with what I have. I don't have any milliliters, but I have my conversion. So I type in my 5 milliliters. I have 1 teaspoon. I have 8 teaspoons because whatever I do to the bottom, I've got to the top so they can cross out. Okay, I don't have any other numbers to use. So 5 times 8 is 40. 1 times 1 is 1. Divided by 1, it's still 40. All right, now I'm going from larger to smaller. So I multiply my conversion times my what I have, and I get 40. All right. All right, so now a patient, whatever, who cares? All right, a patient needs 60 milliliters of medication. How many ounces is this? 1 ounce is 30 milliliters. If you can do this in your head, great. If you can do any of this in your head, that's wonderful. I'm so proud of you. Great. But someone can't, so we have to explain this, okay? And that's okay. So my question is asking for ounces, so I put ounces over here. I don't have any ounces, so I throw in my conversion, right? So my 1 ounce is 30 milliliters. I do have some milliliters because whatever I do the top, I gotta do the bottom. Whatever I do the bottom, I gotta do the top, whatever. I have 60 milliliters, right? My milliliters cross out. I'm left with ounces. I've used all the numbers I have. 1 times 60 is 60. 30 times 1 is 30. 60 divided by 30 is 2. All right. So which one's bigger? Our ounces. So we're going from smaller to larger, so we have to divide. We put our desired on top, our have on the bottom. What we have is a conversion. So 60 divided by 30 is 2. All right, now my patient weighs 150 pounds. How many kilograms is it? All right, so my conversion, I didn't write it up here, whoopsies. 1 kilogram is 2.2 pounds. So I start with what my question is asking for. It's asking for kilograms. I don't have any kilograms. I had to throw my conversion in first. 1 kilogram is 2.2 pounds. I have pounds because whatever I do at the bottom, I got at the top. 150 pounds over 1. My pounds cross out. 150 times 1 is 150. 2.2 times 1 is 2.2. 150 divided by 2.2 is 68.18. Repeating. Remember that sign? So there's an unspoken rule that if the answer is asking for kilograms and it doesn't tell you what to do, you round to the nearest tenths. Don't worry about it because yours is going to tell you what to do. 68.2 kilograms. All right. So let's remember love, sex, money. Students love drugs. Okay. Which one's bigger? Kilograms. So it takes 2.2 pounds to equal 1 kilogram. So we take our desired 150 pounds. We have 1 kilogram, 2.2 pounds. To do it, we divide and we get the same answer. All right. So I circled this because this is how I read it. Okay. My order reads for buterbital 60 milligrams PO 60 minutes before surgery. How many tablets are you going to administer? So this is our bottle. Our bottle has 30 milligram tablets. You could probably do this in your head. That's okay if you can't. So I always start, when I have these long word problems, I always start with rewriting my question. So O means order. My order is 60 milligrams. Sometimes I'll add the frequency behind it if it matters. I have available 30 milligram tablets. They are the same medication, so we are good there. My question is asking for tablets, so that's why I always put my Q. My order is 60 milligrams. I have available 30 milligrams. My question is asking for tablets. So, dimensional analysis. 1 tablet is 30 milligrams. Okay. 1 tablet is 30 milligrams. We know that right here. Whatever I do at the bottom, I've got at the top. So that's when I add in my order. My 60 milligrams over 1. My milligrams cross out. I'm left with tablets. That's how I know I have the right answer. And there are no other numbers in here that I'm supposed to be using. 1 times 60 is 60. 30 times 1 is 30. Divided is 2. So now we have that desired over have times volume. That's where this comes in. So we put our desired on top. We put our have on bottom. And we don't have a volume because this is tablets. So you multiply by 1. 30 divided by 60 is 2. 2 times 1 is 2. The important thing to remember if you're doing desired over have is that these are the same unit of measurements. If these are not the same unit of measurements, you cannot just plug it in. And it's going to matter in a couple minutes. Okay? All right. So a patient, how many tablets of this analgesic for a dose containing 10 milligrams per 60? All right. This one always throws everyone off. So I'm going to keep clicking through so you can see this right here. All right. Number 1, I rewrite my question. My order is for 10 milligrams of hydrocodone and 600 of acetaminophen. I have in this bottle 5 milligrams and 300. So that's why I wrote that. I didn't write any of the I didn't write any of the units of measurements. You should definitely write those up here. I'm so sorry. Okay. And my question is asking for tablets. So this is my pill right here with my scored. It's my scored tablet. Number 1, if you get a half or like 1.5, 0.5, 3.5 for a answer and it's a tablet, and then you ask yourself, is this tablet scored? Yes. For testing purposes, all the tablets are scored. Okay? You can have as many ones as you want. So this pill contains 5 milligrams of hydrocodone and 300 of acetaminophen. All right. If I half this pill, I cannot decide to only give 1 milligram of hydrocodone and 400, I'm sorry, 250 of acetaminophen. If I half it, it's half. If I give it whole, it's give it whole. Okay, you can't separate the two. I can't say, hey, I want 5 milligrams of hydrocodone, but 200 of Tylenol. Once it's in a pill form, you can't undo it. It's either half, whole, double, 1.5, 3.5, whatever it is. Okay. So when I say this next part, pick one. Just pick the first one or pick the second one because these have to match. They have to be in the same increments. And if they're not in the same increments, you can't do it. So if you have a combo pill, that's that slash one, you can't pick and choose how many molecules of each one you got. It's either half or whole. So just pick one number, pick the 5 or pick the 300, pick the 10 or pick the 600, but you better pick the same side and do the math. Okay. So one tablet is 5 milligrams because I'm picking the first one because that's the easiest one. Okay. I have 10 milligrams is what I need. So my milligrams can cross out. I'm left with tablets. I've used all the numbers I'm supposed to use. 10 times 1 is 10. 5 times 1 is 5. Divided is 2. You can do this again with the 300 and 600. You're going to get the same answer. It is still 2 tablets. But there is no point in adding it in here. Once again, if I'm doing desired over have, I pick one. I picked my 10. I desire 10 milligrams. I have a 5 milligram tablet. I divide, I get 2 times 1 is 2. 2 tablets. That one's a little confusing, and if you need help, put it in discussion board. All right, we're almost done, I think. All right, so now we have azithromycin to be given 500 milligrams PO stat, and then 250 for 4 days. Determine how many milliliters you need to administer. Okay, so earlier we were talking about I don't care what the reconstitution is. Okay, this pretend this one is a reconstitution. Okay, let's pretend it says to add this 9 milliliters of water to the bottle. Okay, the 9 doesn't matter. This reconstitution doesn't matter. What matters? This concentration. The concentration says, guess what? Whether my instructions say to add 50 milliliters or 9, I'm assuming my instructions are correct, number 1. And number 2, my concentration isn't going to change, okay? Whatever it says, I don't care for my math because my concentration is my concentration. All right, so let's highlight some important numbers. 500 milligrams stat, 250 for 4 days. My answer is looking for milliliters, but it's only looking for the stat dose. So let's rewrite our question. My order is for 500 milligrams. I don't care about this 250 for 4 days. Don't need it. Okay. I have available 10 per 5, not this 9. Who cares about the 9? 10 per 5. I'm so sorry. 100 per 5. I'm saying 10. Sorry. All right. My question wants to know milliliters. So I write out here what I want first. I want milliliters. Do I have milliliters? Yes, I do. I throw my 5 milliliters in. What's attached to my 5 milliliters and can ever be separated? 100 milligrams. So I add that at the bottom. Do I have any other milligrams? Yeah, I have 500. So now I have my 5 mils over my 100 milligrams. I add my 500 milligrams. I cross them out because they cross each other out. I don't need this 250. I don't need this 9. I don't need any other numbers. I've used all the numbers that I need to use. I'm left with the measurement that I want because they all cross out. And now I get to multiply across. 5 times 500 is 2,500. 100 times 1 is 100. 100 divided by 250, 2,500 is 25 milliliters. So I would give this patient 25 milliliters. All right. So now if I was doing desired over have, I look up here, my desired 500 milligrams. I have available 100 milligrams. I have a volume, so I can't forget it, 5 milliliters. So 500 divided by 1, 100 is 5. 5 times 5 is 25. And that is how you get that answer. All right. So a patient needs 30 milliequivalents of potassium daily. I have a 10 milliequivalent tablet. How many tablets are you going to give per dose? Per dose. So 1 tablet equals 10 milliequivalents. But do I have any other milliequivalents? Yeah, I have my 30. So those can cross out, and I'm left with tablets. I've used all the numbers. 1 times 30 is 30. 10 times 1 is that's supposed to be a 10. I'm so sorry. 10 into 30 is 3 tablets. You can do this in your head. Great. So desired 30. I have 10 times 1 equals 3. All right. All right. So now I only have a couple more. All right. Now I have a patient who needs this medication, 1.8 grams PO daily. I have a 600 milligram tablet. How many tablets are you going to give? So we start with what it's asking, capsules. So, or caplets, tablets, whatever, who cares? 1 capsule or caplet is 600 milligrams right here. I don't have any other milligrams. Okay. But I do have a conversion, so I'm gonna throw this conversion in. 1 gram is 1,000 milligrams. So I type in my 1,000 milligrams and my 1 gram. So now my milligrams can cross out. Now, whatever I do at the bottom, I gotta do the top. Do I have any other grams? Yes, I do. 1.8. And then I have it here. So my grams cross out. I'm left with caplets. I've used all the numbers. I've done all the things. 1,000 times 1 times 1.8 is 1,800. 600 times 1 times 1 is 600. Divided is 3 caplets, capsules, whatever. All right, so now we have this lovely thing. So again, like I said earlier, if you're doing desired over had, it doesn't matter if you were doing that, that's great, whatever, but they have to match. So whether you make this 600 milligrams into 0.06 grams or this 1.8 grams into 1,800 milligrams, I don't care. Pick one, make them match. I like to make the small numbers go bigger because it makes my brain feel better. So I'm going from a large number to a small number, so I multiply. So 1.8 grams times my conversion is 1,800 milligrams. So then I can plug in my formula because I have 600 and I have 1,800. So my desired is 1,800. I have 600. I divide times 1 is 3. Do not forget that step. If you forget the step, then it's not going to work. All right. So I have the physician orders 7.5 milligrams per kilogram every 12 hours. The strength that we have on hand is 250 milligrams per 5 milliliters. How many milliliters are you going to administer for a patient who weighs 70 kilograms? I know this is crazy. Just bear with me. I rewrite my question. Okay? My order. Don't read the line. Don't look at that line yet. Okay? It's 7.5 milligrams per kilogram. My patient weighs 70 kilograms. So I added that all up there. I have available 250 per 5. And my question is asking for milliliters. I pulled all those numbers and made it simple so I can read it here. Don't worry about all the words. Who cares about all the words? Rewrite it. Okay? All right. And this is why I like dimensional analysis. Okay? So it's asking for milliliters. Do I have any milliliters? Yes, I do. 5 milliliters over 250. Because they're attached, they can never be separated. Do I have any other milligrams? Yes, I do. 7.5 per kilogram. Once again, they can't be separated. They have to go together. Okay, so my milligrams cross out, but now I'm left with this kilogram. I've got to get rid of it. So I plug in my weight, my 70 kilograms over 1. So now my kilograms cross out and I'm left with 5 milliliters. I've used every number up there that I need to. I'm done. 5 times 7.5 times 70 is 2625. 250 times 1 is 250. Divide, and I get 10.5 milliliters. Okay, so to do desired over have, you can do it either way. You can put the 7.5 in and plug it away, but you have to remember to multiply it by your 70 kilograms. Personally, I like to get it out of the way. Okay, so this per means that every 1 kilogram, I get 7.5 milligrams. Okay, that means so if I weigh 70, I can either add up 7.5 70 times, or I can just multiply it. So 7.5 times 70 is 525. So that is our new order. That's what that line is for. Our new order is for 525 milligrams PO every 12 hours. So desired over have times volume. So 525 desired, my 250 I have times my 5 volume. 525 divided by 250 is 2.1 times 5 is 10.5. All right. So last one, praise the Lord. My order is for 0.6 grams. It wants to know how many milliliters. I have a 900 per 6. I also see this 150 per 5. Just either number. I don't care. Just pick one. They mean the same thing. If you divide 900 by 6, it equals 150. Okay. I like to use the big numbers because they're pretty in green. So my order is 0.6 grams. My available is 900 per 6. And my question is asking for milliliters. So I put it over here, 1 milliliter. I put my milliliter. I have milliliters. I have 6 milliliters equals 900 milligrams. Beautiful. Perfect. Great. Do I have milligrams? No, I do not. No, I do not. I have to throw in a conversion. So I put my 100 milligrams in my 1 gram. Well, now my milligrams cross out, but I'm left with milliliters per gram. I don't want that. I got to get rid of this grams. So I've got to plug in my order, my 0.6 grams. If I cross those out, I'm left with milliliters. I'm not left with anything else. I've used all the numbers. So 6 times 1,000 times 0.6 is 3,600. 9 times 1 times 1 is 900. Divided is 4. All right. So once again, these don't match grams and milligrams. So I've got to make a match for them to be plugged into my formula. Like I said, I don't care which one you do. If you want to make 900 into grams, that's fine. I like to make the small number get bigger. So grams is larger than milligrams. So I multiply. So I'm going larger, smaller, multiply. 0.6 times 1,000 is 600. So that is my new order. So 600 is my desired, 900 is what I have, times my 6 milliliters. 600 divided by 900 is 0.6666 repeating. Do not, one more time, do not round. Keep that ugly number in your calculator. That 0.666666666666 is if you round, you will not get the right answer. Do not round in the middle of an equation, ever, ever. So 0.66666666 times 6 is 4. And that is the answer. If you do not understand math, please ask for help. Okay? It is okay. Math is hard. We're adults. Learning math as an adult is hard. If you need help, please ask. But if you don't ask, we won't help you. Okay? Be expected to see math on every pharmacology exam ever. Ever. Okay? From here to the end of time, you will see. Lastly, do not put your units of measurements in the answers. If it says use numbers only, do not use anything else besides the number. If the number is 0.6, put 0.6. Don't put 0.6 mLs because you will get it wrong. Don't put the unit of measurement. Put the answer only. All right. you have any questions, put them in the discussion board. Ask for help. Good luck. Well, if I could figure out how to work this computer, it'd be nice.